I've been working with stroke survivors for many, many years, and one of the things that I noticed is that patients were not getting the right care at the right time. They're really overwhelmed when they leave the hospital. They've met a lot of physicians, met a lot of other healthcare providers, and they get a pile of instructions which baffles them. We wanted to make it really easy for them to get what they needed when they left the hospital. We worked together as a group and talked about how can we look at this more from the patient side of things rather than our side of things. How can we set up a program that supports the patient from the time they leave the hospital until really the time they don't need us anymore. So we got a grant and proposed that we would have a care coordinator.
I consider myself the one-stop shop. If people have questions about anything, about their medication, about doctor's appointments, therapy, if they need equipment, they don't know who to call. After they discharge, they don't call the hospital to answer those questions. Their primary doctor probably doesn't know those answers, so who do they ask? So they're grateful to have one person to call.
We've had some success already, replicating it in different settings, and I think that you could replicate this model in just about any program where there are patients with complex needs in the hospital going on to an outpatient setting.
So I had one lady call me and her speech was slurred, and she said, I don't know what's going on. I feel fine, everything's working fine, but my speech is a little bit off. And I told her to call 911, and she was brought to the hospital and found that she was having another stroke. So she was able to get the medication to prevent it from becoming worse. She thanked me over and over again for saving her life.
Our project really started with the emphasis on transitions of care and really helping patients have more of a smooth transition between hospital to home or whatever their next stage was. And we wanted to incorporate pharmacy services into that so that as patients were leaving with new medications or medications that have changed, that a pharmacist was following up with them post-discharge so that they made sure that they were getting the most out of their medications, there weren't duplications, and they really had the confidence in taking their medications.
We worked with colleagues across the state in MTM to develop a referral process. So if we identified that one of their patients were admitted to our facility and that we deemed that they are appropriate for MTM visit, we would notify them when the patient was discharged so that patient could have that visit with a pharmacist in their healthcare home.
I think one of the most exciting parts of this work is just knowing that the patients are getting the care that they need. So many times when I reach out to the patients, they are confused about what they're supposed to be doing. And I just think it's really great that there's someone out there to help them through that process once they get home.
Mental health and behavioral health is another large area for us. There's lots of opportunity to try to improve that care. And if we can kind of keep those core fundamental beliefs of, you know, what's best for our patients, how can we communicate to get things done, and what kind of pieces do we need to put in place, I think that would make a lot of change for other practices as well.